Thank you very much. Thank you very much.
Hello, can you hear me now?
Yes, yes, ma'am. We can hear you.
Okay. For CSOs, I believe that we are doing a lot of awareness and a lot of sensitization at the community level, but that is not that enough. During the pandemic, the response was slow because everybody was new to lockdown. Everybody was new to how we are responding to it. So I won't
Yeah.
blame anybody, rather that we have learned a lesson about what are the issues that came up during the pandemic, especially how it affects women in the rural community. I believe government can do a lot of policy framework that will harness so many issues that came out from, most importantly, from the research that is being done by CSOs, to make sure that they recognize CSO, government recognize CSOs as frontliner as well as nurses. We have to fight our way for government to give us passes to travel, to meet up with women that are in distress, that call on distress where they have intimate partners beating them, and we know it can result to death. So we have to fight our way with the government to make sure that we collect government passes and releases on highways so that we can travel. So government have now see that it is important to see CSOs as frontline workers, even if our work are unseen, if our work are unpaid, they just have to make sure that yes, we are doing something that is a big gap that we are trying to fill there, where government cannot reach out to everybody. That being said, for psychological support for women, for religious leaders, we have to keep on pressing about issues concerning mental health in churches and in mosques. They shouldn't leave it to health practitioners alone. We have to talk about mental health. We have to talk about it and remove the stigma about discussing mental health in public spaces. So religious leaders have to do their own part too, to make sure that everybody have a psychological protection in times when we have lockdown like this. Also, at the community level, CSO too have to sensitize community, has to organize and have a social support for themselves. How rural women can form social support for women among, or girls among their facility, before even government can come to help them. How we can train them to have a support group and support each other when there is a lockdown. Thank you very much.
Thank you very much. Thank you very much, Ma. Well, creating awareness and having a policy framework would really go a long way into doing all of this. Thank you very much, Ma. Miss Sarah, do you have anything you'd like to add to this before we move to the next question?
Okay. So concerning the provision of psychological support, especially with the religious leaders, it's very important because a lot of women and men are easily influenced by their places of worship. So I feel that I believe we can have grassroots sensitization where we reach out to these religious leaders, invite them for seminars, train them and teach them on the importance of support for women. And if they are very much enlightened, it's easier for them to cascade this information to their members. And their members, it's easier for them to to be enlightened. And also the psychological support, um if after enlightenment of these religious leaders, we can also propose perhaps a support haven where these people can, whoever is in need of psychological support can come meet once in a while, something that they do for people that are battling with alcohol, where they come once in a while, to talk and, express themselves, speak their mind freely with people who are in the same boat, likewise, like them, something of the nature. It helps and, fosters a bit of trust and, helps expand on their vulnerability and teach them on how to improve themselves. Technically, that's from the religious leaders' point of view.
Wow. Thank you very much, Ma. Thank you. So I will quickly move to the next question, which is what are the health protective measurements that has been implemented by the CSOs, development partners, religious leaders, government to safeguard women at this COVID-19 frontline? I know when the whole lockdown started, there's so many things that CSOs and all of that were trying to put in place. So what have you done um, pertaining to your organization, wherever you are? What have you put in place concerning that? Who would love to answer the question?
Sorry, can you repeat the question again?
So what are the health protective measurements implemented by CSOs, development partners, religious leaders, and government to safeguard women at the COVID-19 frontline? What has been put in place already? What have you started doing? The health protective measurements you've already put in place. Ms. Blessing, would you like to answer that question, please?
Concerning the health issue, I would say for us here in Daughters of Abraham Foundation, where we keep girls in the shelter, I won't say much have been done for to cover that aspect of health. We are still working with partners like IHVN to see how we could do that, but I don't think there's any concrete thing on ground for health for women, starting from us here in our shelter and the communities we've worked with is still the same thing.
Hmm.
Recently we because we run a shelter for victims of sexual violence and GBV. And when these
Wow.
girls came back from the Christmas break, when we resumed in January, we contacted several medical facilities here in Abuja, government hospitals where these COVID tests are being carried. And we told them, okay, these
Hmm.
are the kind of girls we have. We would like you to come do COVID tests for them before we accept them into the shelter. And it took a very long
Hmm.
process. We couldn't even get the government officials to come. In fact, when we eventually got to the NCDC, we got an official there and he was charging us 15,000 for one person. That was the least.
Person.
Yes, test our victims and survivors of GBV in the shelter. And we had to, okay, we don't have that kind of money. We are non-profit. We are also trying to help these girls. We had to go to a government general hospital to do it. And as I speak to you, up till today, we did that test towards the end of January, and this is March. The result has not been released. We asked, they'll say the result is not released, whatever. So I don't think the government has done anything so much in that aspect. And for CSOs, I know a lot of CSOs are trying, though their hands are really tight. But we're all trying to do the best we can do to see how we can push that. But that's a gap and that's a big challenge we are facing in the health sector. Thank you.
Wow, thank you very much, ma. These are great concerns that the government really needs to look into. Really grave concerns. Abra Stokely, please, is there anything you'd like to say concerning this?
Just that we're working very hard with our children to support them emotionally. I mean, obviously the last year is going to have an impact on their academic progress. But for me, my greatest worry is about the emotional and social toll on young people. And we've been working really actively to try and deal with that. You know, some of our youngest pupils, you know, things like turn taking, all the things that you learn at school, all of those soft skills, we're really having to work very actively with them. But it is clearly more widely in Nigeria and beyond, the emotional toll on children is something I'm very concerned about.
Yeah. The emotional aspect. Yeah, thank you very much, ma. So we've seen that intensifying efforts for women and girls, not only for the women and girls, but focusing on the men and boys, and CSOs having a very important role to play in all of this. And the need to meet religious and traditional leaders to really play a key role in this as well, creating awareness for them, policy frameworks that would harness the situations, and also bringing up grassroots sensitizations. Thank you very much. I really appreciate all your contributions towards this. So we'll be moving further to challenging cultures. We're looking at the problems affecting women's leadership and political participation. Are you with me? Are we together,
Yes,
please?
we're here. We're here.
Yeah. Okay, so we see that from the local to the national level, women are underrepresented as underrepresented as voters as well as in leading positions, either in elected offices, the civil service, the private sector, or academia. And this occurs despite their proven abilities as leaders and agents of change and their right to participate equally in democratic governance. I always want to make reference to the woman that discovered COVID-19 in Nigeria. She being the one to have actually discovered COVID-19 in Nigeria. When they created a task force, there wasn't any woman actually added to it. So that is one of the challenge that we are actually facing now. And as the 2011 UN General Assembly Resolution on Women's Political Participation notes, women in every part of the world continues to be largely marginalized from the political sphere, often as a result of discriminatory laws, practices, attitudes, gender stereotypes, low levels of education, lack of access to healthcare, and the disproportionate effects of poverty on women. Now we see women serve as heads of state or government in only 22 countries in the world, and we have so many countries all over the world, and 119 countries have never had a woman leader. Now at the current rate, gender equality in the highest positions of power will not be reached for another 130 years. Now, down in Nigeria, there are only 7 female senators of the Ninth Assembly, which is very, very poor. And in the last election, the representatives of women in parliament was a total of 5.5%. Another major problem affecting women's leadership is electoral violence that has been identified as a stumbling block to robust participation of women in the political process, leadership, and in governance. Violence against women is used as a targeted and destructive tool in various ways throughout the electoral cycle to dissuade women from participating as election administrators, voters, and candidates. Also, the lack of an economic base for women has been a factor in their participation. Yeah, so the lack of an economic base for women has been a factor in their participation, or lack of it rather, in politics because of the cost of campaigning is very high. Lack of financial resources can limit participation given the costs associated with elections. But of course, there are solutions, innovative solutions to women's leadership and political participation. And they include training for women political candidates, encouraging young women and men to engage in advocacy around making gender equality measures central to public policy making, just like what Ms. Jane said, including the men in the decision making also, advocate access to an independent National Electoral Commission and political parties to ensure strict adherence to it, putting women at the center of the decision making of the COVID-19 response, and also funding grassroots organizations that build the capacity of women to participate both individually and collectively in social, economic, political, and public life, as Madam Sarah said, grassroots projects for organizations. Now we look discussing the what are the factors affecting women's political participation in Nigeria? The ones I listed are just little of of a lot. We have like so many factors that's been affecting women's political participation in Nigeria. So we'd love to ask, what are the factors that are affecting? Mr. Adewumi, would you like to answer that question, please? Miss Sarah, we're listening to you.
Okay, I would speak on one factor that is very, very prevalent, and that's a stereotype. And if you look at it, it is very vague to say, oh, stereotype is actually preventing women from participating at the political level. We have this traditional or cultural stereotype, and this has destroyed a lot of potential women politicians from participating, because whenever a woman comes up to talk about, oh, I would like to go for House of Representatives, I don't like the way things are being done at the local level, you see someone come and say, you're a woman, what can you do? And because of that cultural stereotype, a lot of people would rather just keep whatever they want to do. A lot of women rather would rather keep whatever they want to do in their mind than speak out, for fear of being, victimized and ridiculed. And this stereotypical factor is not just streamlined down to the traditions or the culture, because a lot of cultures that would, prevent a woman from actually speaking, talk less of actually speaking her mind, which would go against, like, half the time, go against what a man, is talking about. Also, it also stems down to the religion. A lot of religion actually, encourages the woman to be silent. So a woman would feel stubborn or headstrong if she wants to go in court for a man's role. So a woman comes up and says, I want to be the local government chairman of XYZ community, or I want to, go for the senator of this particular location in a particular state. There's someone telling you as a woman, what can you do? Don't you know that women are supposed to be, submissive to a man? All of these factors, they downplay the role and effect of women in politics. So if you see the few, there are hardly a number of women in politics right now that do not have some sort of male influence. They do not have, you can count the very minimal that, they say, oh, I'm coming out on my own, I'm going to garner support on my own without having a male influence or some sort of godfather factor. So that is the major problem. The tradition is a huge problem. The religion is a huge problem. Women would just like take several seats back and stay in silence than actually speak for fear of going against their tradition and perhaps their religion.
Yes, wow. Thank you very much for that. Thank you very much for that.
Can I also add?
Yes, please. Yes, please.
Yeah, just like she said, the last speaker, thank you so much, Ma. You really hit the nail on the head. Like, this is one of the issues that this is one of the greatest things that has affected women so much in the public policy spaces. This statement of how can a woman lead us has made it difficult for women to thrive. Even in that political spaces, you see that even if there is a woman there, a man is the head, and she will in no way or the other must submit to what the man wants. So you see that she cannot even make decisions on her own and carry it out. There must be an instruction from the male who is directing that establishment or wherever she is. In communities, in rural communities, you find out that this statement has done a lot more harm. This belief that the man is the head, how can a woman come to direct us? How can a woman tell us what to do? Has really done a lot of harm. That is why I'm so happy about one of the communities we did an intervention. We just found out that in that community now, the cabinet, the traditional rural cabinet, normally in eastern part of Nigeria, women are not allowed to be part of it. But in this community, as we currently speak, women are now part of this cabinet. Their job now is to, whenever there are issues, they go for meeting and they bring up their issues and it is discussed and addressed. This community has low rate of female genital mutilation, low rate of child marriages, low rate of domestic violence, because women have been accepted into the traditional leadership system. But in the public, in a wider view, like in Nigeria, just like you mentioned, the number of women who are senators, they can't do it alone. They have men who are backing them up, and they must play to the tunes of the male folk. That is why we have this undue representation of women in political spaces. Thank you.
Thank you very much. Thank you very much. Yes, thank you very much, Ma. You said it all. You said it all. Madam Mojisola, would you like to add anything to it?
Yes. When we talk about women leadership and political participation, there are so many challenges, and there is so many ways strategically that women too can make sure we can move the activism forward, and enough of talking and to have to take action before 2023. I was at the radio program this morning, and it's a phone-in program, and some of the things that came up, keep on coming up. is that the perception that men has. I now want women to now change that narrative now, to let us stop the stereotype or to change the misogyny of conditioning our brain that we hate each other, rather than seeing this as human dynamics. That is, wherever men and women are, even if you have twins, both boys and girls, they will still compete within themselves. So competition, interpreting it as being human dynamics of hating themselves, is a wrong perception. So I believe women too, we have to go out there to change the perception of both men and women, to make sure that we are not hating ourselves, but it's a perfect competition between human beings, which is normal. When you compete for space, for power, for food, whatever you compete for, then people will now give it a negative connotation that you are hating themselves. No matter what, when you see women in politics playing the same card, they won't go plotting to kill themselves. You know, they won't go plotting or scheming to kill themselves. But all they have to do is, let me use, some hatred war, some, backstabbing to do it, which is normal in human dynamics. But you will never see a man calling themselves that men hate each other because they kill each other for politics. So I want us to, to learn, to unlearn, and to relearn nature and negative connotation that push women behind, not to occupy the space. It is the same structural barrier that is limiting women to occupy leadership positions that is actually affecting us. My second point is that the unpaid care work is the burden of the home, the domestic work. Nobody is seeing it as a work. Nobody is seeing it. It is invisible. Every man, every boy type believes men are, they are genetically prone to do that. So it will limit you to go to political meetings. It will limit you to go to work that will give you enough money to play the politics. So if the unpaid care work can be feasible, can be divisible at home, at that level, we'll be able to work and be able to, harness our power and energy in some other things like politics. So thank you very much.
Thank you very much, ma'am. Thank you. Wow. You just said it as it is. And I believe also the issue of women hating on women, that is a very big issue too. Most women know how to do that kind of thing. They don't want to really see their own woman at the top or doing great things. They just start hating and hating and hating. So thank you very much, ma. So quickly, we just move to the second question. This is, as a civil organization that's focused on young women's rights, what has worked over the years in your implementation of women's political leadership? What have you been doing? What have you done over the years of in your implementation of women's political leadership? Who would like to answer the question? Madam Abra, is there anything you'd like to say on the question?
It's not really my area of expertise, so I will defer to others on the panel.
Okay, Madam Sarah. Madam Sarah, is there
Okay.
anything you would like to?
Okay. Women in Parts Nigeria. For advocacy, we've stemmed on the belief that in order to get women out there, in order for them to believe that, oh, I can vie for a key developmental position, or I can be someone big in the key sectors. We believe that advocacy is key, and for the past 5 years, we have gone on several advocacy schemes where we've had to enlighten women from all cadres, from grassroots to women even working in multinational. It's a way to encourage and stem off their belief that regardless of their gender, they are supposed to be wherever they want to be. And for politics,
Yes.
we try to encourage women in our advocacy campaigns. We try to have a lot of, when I spoke earlier, I spoke about grassroots campaigns, but we like to promote on the third area and speak to these women. You can't just sit here and expect the men to speak up for you. It's something that as a woman, you know what exactly is the problem and how, there are no solutions, given. So definitely you have the solutions because you know the problem. Why don't you speak? And as a result of that, we've done several campaigns. We've done media campaigns. We've gone out to do advocacy campaigns. Even brought men to speak up on their behalf. Tell them that, okay, as a woman, you're not limited by your reproductive organs or by your physique or by your lack of strength. You can go out, and vie for a position of, even if it's a keynote speaker, encourage women to actually speak. And in politics, you can go as high as even the presidency. For remote, women in remote areas, we try to encourage them that you can go for community leaders. You don't have to always wait to be, okay, let the man speak and then we go and ask him so that I can give advice or whatever. You can strive to be the head, and if people say that you're capable of doing this thing with a lot of support and advocacy, because basically the way we can go about this is only advocacy. And what has worked for us in the past is advocacy. We've had testimonies of women who say, oh, before women in parts of Nigeria came, we didn't know how to put on our brave face, or like we call it in Wayne, put on our brave coat and go out to speak. But a lot of women right now, they've realized beyond their physical attributes, they have a lot to give. And in politics, we've ensured that a lot of women are enlightened that, okay, whenever there is a position that you would like to apply for, depending on, regardless of whatever position that is, you as a woman, you're liable to apply. We can say, okay, there are factors affecting like funds and support from other people. Why don't you take the first step? So we make everybody understand through our advocacy, media campaigns, our grassroots intervention, that as a woman, you are not relegated to the back. You can be at the front with as many people as you want. Whatever your choice, you must endeavor to take.
Thank you very much. Thank you very much, Ma. That's amazing. I'm so glad that in your organization you've really been working hard, fighting for the implementation of women's political leadership in Nigeria. Thank you very much.